Hello everyone, this is William Salvador here, and this is my capstone course project. Um, my project is over patient safety via teamwork, and this intervention plan is going to be for the nursing staff on nursing units. The goal of this intervention is to guide nursing teams to a level of performance that is safe for patients and benefits both the patients and the team members themselves. I will be presenting this intervention to both leadership and the team as educational material, and it will potentially benefit the team and improve the work environment. The education material will include tips, tricks, and habits to form that will increase teamwork and promote communication among team members. The improvement plan items will be a part of an educational integration initially, and then we can reinforce the education material as needed. This is not meant to expect more out of team members, but to help provide them with a more suitable environment for them and their patients. The purpose of this intervention is to guide team members away from toxic environments, because nobody likes that. We want to promote positive work relationships and improve patient care. Hopefully we will reduce burnout and work stress, and frankly just make work more enjoyable and maybe give us a little camaraderie. The ultimate goal here is to improve patient safety. Patient safety is greatly increased when teams focus on teamwork and communication. In practice, especially when shorthanded, teams struggle to communicate and work together. It's not always easy whenever we're focused on trying to get our job done. We end up making excuses like I'm too busy or I can't keep up. So we end up trying to focus on getting our own job done instead of helping out our team, which would benefit us more in the long run. We tend to drift away from that mentality. Because of this, there are many barriers to teamwork and communication in nursing. Many causes to patient safety can be resolved relatively easily if the whole team helps. Just some of the barriers to teamwork in nursing is short staffing, lack of communication, poor professionalism, lack of collaboration, confusion of roles and responsibilities, improper delegation, and wasted free time. And I'll go over all of those in just a bit. Just a few of the present issues that we are seeing in the nursing field right now. There's the old nurses eat their young idea, and we are doing a good job of getting away from that, but it's still present. And if we can just get rid of that mentality, we will promote a positive environment for new nurses to come in. They won't get burned out. They'll have safer learning environments for them to learn how to do their job, and students will feel more welcome on units, and staffing will hopefully benefit from that. But also the attentiveness to be able to work with coworkers will improve if we're not, having nurses that eat their young. We know nurses want their new nurses to be tough and have to go through the same struggles they did to get to where they are, and we instead want them to have a positive environment for growth. Also, there is inequality among nursing staff. Nursing staff that are more experienced or have been on a unit longer might feel superior to others, or nurses may feel superior to nursing aides and nurse techs. And in reality, we're all equal. We may have different responsibilities, but nobody is above anyone in this field. We're all professionals doing our job, and we need to support each other equally. And also there is blame culture on some units where it's people focused on whose fault the problem is and whose problem it is, instead of what can we all do to help out and what can we do to benefit the situation together as a team, because we're all in the same boat. And the idea, I'm too busy to help others vibe, We could be really busy, but you're never too busy to just stop and help somebody. It goes a long way for team members. So these are present issues that I feel like we could tackle relatively easily. Why does this all matter? Why not just let nurses try to figure it out? Um, there are a lot of problems that can come up whenever there's a lack of teamwork. Obviously, we could have like patient dissatisfaction if a team isn't working together. They're not going to give satisfactory care. But also, with a lack of teamwork, there tends to be an increase in patient falls, an increase in med errors. There are workload imbalances among team members. There's an increase in burnout among nursing staff, and there are higher risk to harm to patients, and etc. So I have developed a improvement plan that is based off of educating the team members on why teamwork is important. And the nursing team members will be informed that their teamwork is related to patient safety, and improving the level of teamwork may contribute to a higher quality of care and fewer patient errors, which none of us want that. We can start off by expressing the connection between teamwork and patient safety, that it will provide platforming for the transition toward improved patient safety later. Nursing staff want their patients safe, and this ideal could motivate them to possibly see the benefit of improved teamwork and hopefully help them all strive for better teamwork in the future because, of course, everybody wants their patients to be safe. The next step of the improvement plan would be to promote collaboration in nursing tasks. And by collaboration, it might be an aspect of teamwork, but it's a very important kind of first step in teamwork. Working collaboratively among healthcare professionals will increase the quality and level of safety of patient care. We often fall into our role when comfortable with our jobs, but we can't assume we can perform appropriately without collaboration. Communicating with each other, planning nursing tasks together, and periodically checking on one another will create a culture of reliability and trust amongst coworkers. If your coworkers feel like they can lean on you, then maybe you can lean on them too. And also, it'll help everybody plan out their day if we collaborate on the plan from beginning to end throughout the day. Just little bits of communication that promote teamwork. That's collaboration. An example that I have is one nurse saying, "Hey, William, I'm going to take Mr. Doe's blood sugar. Do you want to change his dressing while I'm in there?" This type of communication promotes a willingness to help, awareness of patient needs, and clusters patient care. It's just a quick little bit of communication that could both help other people with time management, and instead of just asking for help with something, it's also clustering everyone's care together. So it's both time management and teamwork improvement. The next step of my improvement plan, we want to adopt a professional equality by sharing responsibilities. This is a big one for me. Teamwork is very important to me, and this is one of the most the biggest aspect of teamwork for me is sharing responsibilities. The incorporation of sharing responsibilities with accountability between team members in healthcare systems offers great benefit to patient care and patient safety. It starts by treating each other as equals. There is no hierarchy in healthcare. No one is more important than the other. Everybody can help with anything that they're certified to do. Nurses are not more certified for no reason. Nurses are more certified, but they're not less responsible. Just because a task can be delegated to an aide doesn't mean it always needs to be the aide's job to do it. Nurses should delegate tasks for the purpose of task management, not because they don't want to perform the task. If a patient is messy and they need to be cleaned up, it is not below the nurse to do that, or If there's a task that is normally the nurse's job, like changing a dressing, the tech could be thinking to themselves, well, that's the nurse's job. They need to take care of it. Well, it's nice to have an extra set of hands in there to help with either of those tasks. So just because it's not under their specific job description doesn't mean they can't help out with it. And just keeping an open mind about what your role is, as long as you can perform the task safely and within your realm of certifications, it should be considered as everyone's job within that role, so that we have plenty of hands on deck. And that is the idea of professional equality. Everybody, like I said earlier, we're all in the same boat, so we can all get our hands dirty. Getting in there and not afraid to help each other out. And then, my last point with my improvement plan is just, be careful what you do with your free time. There are many times team members finish their tasks and use that time to relax, and relaxation is very important. Most of us work 12-hour shifts, and you cannot go ham for 12 hours straight. That's asking for too much. Um, but just before we relax, nursing staff should consider checking on their team members when they complete the tasks. One of their team members could be struggling really bad, and a little help can go a long way. Um, we should teach team members to feel free to relax when they know their team and patients are okay. So just before you go sit down and take a minute to breathe or go eat your lunch or something, just check in on your team members. Ask them, hey, is there anything I can do uh, right now? I'm caught up. I'm about to go eat, or I'm about to go sit down for a second. Just check on your people. They could be drowning. Um, and then, be a resource to your team members. It really means a lot. If you're someone that they can count on to be there for them when they're struggling, they will see you in a new light, and they will often look to you to see if they can help you if you're often a resource to them. It's very common and it's very human for us to repay that nature. And that is all I have for my plan to improve teamwork in the nursing work environment. Thank you, everybody. I look forward to seeing your presentations as well.